maternal health requires coordination across the OB, the primary care, the behavioral health, community providers, and the infrastructure just wasn't built for that.
Hi everyone, thank you so much for joining us today. Our guest for today is Sunday Daniels. She is passionate about maternal health and she serves as an advisor at MA Mom Advocates. And she is very much passionate about working on the maternal health, but she has extensive experience in operation, execution, and strategy for healthcare organizations as well. Sunday, welcome to the podcast. We are excited to have you. And for the sake of our listeners, if you can talk a little bit about your prior experience, I think it would be a great starting point.
Sure. Thank you so much for having me. So my experience has been in the healthcare space, primarily in academia and looking at research centers, but I kind of operate in this space of healthcare strategy, execution, and now that's specifically in maternal health. And that's where success depends on the convergence across clinical care, community systems, and digital infrastructure, where we consistently see consequences when that convergence fails. And so I kind of work trying to see how we can find some spaces where they can integrate, they can align and work together.
Right. Thank you. Thank you for sharing that. And I want to actually start from the same point you mentioned that maternal health is not a knowledge problem; it's a convergence problem, and it's a powerful phrase. Walk us through in little bit detail by what you mean by that.
Sure. So in maternal health specifically, we don't have a knowledge problem, as you mentioned. We have a convergence problem, right? So systems that need to work together, clinical care, community-based support, digital tools, and policy, they simply aren't. It's not happening. And for Black women in particular, the lack of convergence has real measurable consequences. So looking at that, seeing that we already know what that problem is and seeing that we do have this failure, we want to kind of assess and say, how long has it taken, right? There's integrations that are available that took 3 times longer, which then gives you the result of failed convergence, right? So what looks like a tech problem is often a convergence problem. Maternal health requires coordination across the OB, the primary care, the behavioral health, community providers, and the infrastructure just wasn't built for that. And so digital tools I often see struggling because not that they're bad, but because they're trying to plug into systems that aren't communicating, they're not talking. And so the idea would be that to understand that digital transformation is only going to work when it enables a convergence. Otherwise, it just digitizes fragmentation that's there.
So I think you brought up a very good point, especially in interoperability. Interoperability have been a buzzword in healthcare for many decades. I mean, everyone talks about that, and people are trying to build tools and platforms that are interoperable, that are able to exchange data among themselves. But seems like even with the availability of some great tools, some great platforms, the progress is very slow. We are not, please correct me if I'm wrong, we are not achieving value-based care at a pace at which we should have been by now, with availability of all these great tools. So, in your opinion, where is the lag happening? How can we accelerate by transitioning the overall healthcare system to value-based approach?
Sure. So I would say that things are being built outside the ecosystems. So as I had just recently mentioned, right, it's not that we don't have good tech, but in order to help speed that up, we have to look at the solutions that we have available. And a lot of solutions, they're built in isolation. They're not built in partnership with, in this specific area, the full maternal health ecosystem. And so they're designed for health systems, but not necessarily for your community-based providers or the patients even themselves. And when we look at saying, oh, we want to increase access to healthcare, or we want to speed up this integration, we have to look at the tools we have and figure out how they can work best when trying to be implemented and aligned. And in maternal health, especially in the Black and Brown communities, trust is foundational, and it's often overlooked. And trust is really big when you're talking about aligning and integrating various tech solutions. And so it's, tech isn't built for convergence across the ecosystem, and they're working individually, but they have to integrate in order for us to see that speed and to see that access for healthcare to improve in that particular space.
Makes sense. So, in your opinion, and if we talk about Medicaid specifically, so in your opinion, how does Medicaid shape maternal healthcare outcome more than the people realize at the moment?
Well, I would say, I will first say that Medicare isn't necessarily, I'm not a expert in that space, but I do see that there are some holes created because there's certain needs aren't being met, right? So it's there to help the patient, but if you're not checking the boxes that the patient actually needs, right, the support that the patient needs, then we're shorting the patient. We're not supporting the patient. And I think that Medicare could maybe, obviously solution is always, oh, we need more money. But even getting more money, it's making sure it's appropriated and utilizing these various independent solutions in a better way in order to make the Medicare work better for the patient, but also be palatable and workable for the hospital system as well.
Right, makes sense. So you work extensively on policy making and policy side of things as well. So where are we? Are you satisfied with the pace of the way policies are being drafted and implemented, or you feel that we need to accelerate that at the moment?
So the space in which I sit looking at how I am often just watching how policy is being created and giving feedback and insight from my point of view, which is more, when it comes to policy, I'm a little bit more internal facing than necessarily sitting and talking to legislature. I'm not in that space, but right. I can say that I do see some faster movement. Right. I think before it used to be slower, but I think because now communities, people, the public is understanding to speak up and to ask for things that they want, it's helping drive policy. Because otherwise, the government can feel oftentimes so insulated, they are in their own bubble. But I think the more that the patient, the people, the community is saying, hey, I'd like this, and you go to your representatives or the people who can help you, get your voice into the government and help create that policy moving forward, I do feel that it's definitely picking up pace. But we can always do better, right? Nothing's ever perfect, but there has been improvement.
Right. So I think we talked a little bit about trust as well earlier in the discussion. So trust in every healthcare system is extremely important. But if some of our listeners, I think they're founders or they are trying to build applications. If someone is thinking to build an application, especially for maternal health, I think trust should be top-notch priority. What are your recommendations for designing software applications that should incorporate? How can trust be incorporated from software design process or phase in those? What Absolutely. Are your recommendations on those?
So my recommendation is to make sure that as you're developing the software, that you're being culturally competent, right? You're being culturally sensitive. You're doing the research and your demographic and the people that you're running the pilot test on and your clinical trials on. Those are inclusive of the people that you want to utilize your product. So all colors, right? All people, but also, making sure that you're doing any additional internal building of your bench of your team to also include people of color or whatever specific group that you're looking to include or focus on. That's going to build trust, because when the people that you're going to and asking them, we'd like you to test this, we need your data, when they see people that look like them or that are able to identify with them in any way that's either it looks like them or they are, understand the challenge of being under-resourced, that is what starts to build the trust, right?
Excellent. So, in your experience, why some of the great ideas in healthcare space fail when they go to the implementation stage? So, like typically ideas are great, then a solution is built, and then unfortunately that solution does not live up to the expectation. In
Sure.
your opinion, what are the common causes for this?
In my opinion, I think sometimes these things are created, the architecture is built in isolation. So, this founder, this creator has this great idea and they kind of get a little bit of feedback and they just run with it instead of having somebody poke holes in it. That's always kind of what I do is I like to poke holes in ideas, and I think often these ideas don't have holes poked, so they bring them all the way, they get the funding and everything's great, and then it just kind of falls flat because nobody poked holes and you didn't see it from a different point of view. And in my personal opinion, I don't think that's the only thing that could be done, but I do think that that's a very important piece that's often missed is, they're just not asking for other viewpoints or for somebody to find the holes in that particular whatever it may be, platform, app, etc.
Right, makes sense. So, in your opinion, how much work is being done? Especially AI is a big thing these days, and I think AI is transforming almost all industries. So, if you talk specifically about maternal health, what are your observations? Is AI a big thing? Are a lot of systems adopting that, or in your opinion, what's the potential for AI to make considerable impact in this space?
I think it could have a great impact in the maternal health space in various areas. I do feel like, there are some places that we see just in healthcare in general when it comes to dealing with patients of color or patients that are not, the standard. It's almost as though it needs a little bit more culturally sensitive information. It needs some more training, right? Like people think like, oh, this is great and it's wonderful, and it is. I'm a huge proponent and supporter of it, but I think we need to make sure that we're giving it the proper information so it can give us the proper support in
Right.
this maternal health space where we want to use it.
Right, right. Thank you. It totally
Yeah.
makes sense. And generally speaking about maternal health, where you see it evolving in next, I would say 5 years.
Yeah. So I mean, it's definitely, there's no doubt about it that it's going to evolve, but I think in order for it to evolve in the best way possible, I think we really need to start looking at our systems that we're using to support it and figure out how we can align them, how they can integrate. And I think we're kind of coming to a point where that convergence is necessary, right? Like, it's almost you can't do anything without tech involved. I don't think there's even one thing you do in your daily life without it involved. So I would imagine in that space over the next 5 years, we're getting better, right? We've identified the problems. We know the problems that are consistent. And I think that it will evolve, and I do have a positive I have a positive feeling that it's going to get better, and especially in the spaces of Black and Brown women and access to better maternal health care. I just
Mm.
do think that we're going to have a couple changes in systems.
Yep, yep, absolutely. And my final question, and from my perspective, it's very important. For you, uh, what have been the biggest challenge uh, you faced working in this space, and what is giving you hope for the future that is ahead?
Sure. I would probably say my biggest challenge, which maybe some people may not see as a challenge, is that a lot of people aren't aware of such the large problem in maternal health care. They don't realize that there's disparities and that there's problems. And so when you're out in the in the world, everyday world, and you're speaking to people, they have no idea. And so it's kind of like, you have to educate people a little bit or apprise them of the situation and where we're at. And that for me seems to be my first challenge, because I can't do anything else. If you don't know there's a problem, how can I tell you about how you can help the problem or how we can fix the problem? So I find that to be probably my biggest challenge. And what was your second question? I'm sorry.
What is giving you hope right now for future?
For me, I think very similar to my biggest challenge, my hope is that people are becoming more aware of the problem and that there are inequities. That meter is shifting a little bit. That it's shifting. It's definitely people are becoming more aware, and that, along with the growth of the tech and the platforms and the innovation, I'm very excited, because I think, as I said earlier, at some point there will be a convergence, there will be an alignment. And so that, seeing all this growth is giving me hope, because that means that someday we can come close to closing the gap, and kind of correcting some of these inequities and making maternal health care better for everybody.
Yep. And thank you so much for taking our time, sharing your insight. I really loved your passion and the way you speak about this topic. It really shows your authenticity and your emotional involvement in really making
Thank
a
you.
positive